Welcome back to Joy in Our Town. I'm your host for today, Andrea Hardiman. There's been a lot of talk about healthcare issues here in Bexar County, but one area that doesn't seem to get much attention is about mental health. With us today is Leon Evans, President and CEO of the Center for Healthcare Services. Leon, thank you so much for being with us today.
Yeah, Andrea.
So first of all, let's talk a little bit about what you guys do at the Center for Healthcare Services.
Sure. We're Bexar County's mental health authority, and we treat people in psychiatric crisis and people that have severe mental illnesses. About 25% of the population sometime in their lifetime will be diagnosed with a mental illness, either schizophrenia, bipolar disorder, major depression, phobias, post-traumatic stress, or some kind of anxiety disorder. And the sad thing about it is most of those things go untreated, so people tend to start self-medicating with alcohol and drugs, and sometimes their actions become estranged to their families, and there are lots of problems because they go undiagnosed and untreated.
So let me ask you this. Let's back up a little bit, and you shared a few of the mental illnesses, but let's really help our audience understand what mental illness is.
Well, mental illness it's kind of like diabetes or any other kind of disease. Your brain's an organ, and you have chemical processes in your brain, and when that chemistry is off, then it causes problems with your brain, which is the main organ in your body, and it's the part of your body. There's no health without mental health. It's the part of your body that experiences joy and in family, and so people are most terrified of having Alzheimer's and losing that connection, and so mental illness it's kind of like that. You lose your ability to relate and function properly, and relate to your family and friends, and it causes a lot of havoc. But sadly enough, there's so much stigma associated with it, mainly because there are a few sad happenings, like the gentleman that shot the congresswoman. So people tend to think if I have a mental illness, I'm going to be dangerous to myself or others. But in reality, you're more likely to be a victim of a crime if you have a mental illness than a perpetrator. If you're normal, you're more likely to commit a major crime than if you have mental illness. But so there's this broad brush, and so people are afraid to embrace their illness and get treated because they think they're going to be considered by family and friends as one of these dangerous people, when that's absolutely not the truth.
Are there any other stigmas associated? I never really thought about, oh my goodness, I may be a danger to somebody. I don't want everybody knowing. But are there other areas of concern that one of our community members may have to not get treated or not get the help that they need?
Sure. Well, we are probably the only major city in the United States, and maybe the only community, that has resources that could have prevented the shooting like that happened at Virginia Tech.
Really?
Or the recent shooting in Aurora, Colorado. Our police chief and our sheriff has embraced crisis intervention training, so our law enforcement officers go through a 40-hour course, and there's lots of role playing, and they're taught to recognize mental illness. And when a law enforcement officer and the public are most at risk is when they go out on a mental health call or a family disturbance call, because when they go to academy, they're taught to use their command voice and command presence. Well, if you're scared or paranoid and somebody gets in your face, it escalates, right, and people get hurt that way. So these officers are trained to recognize, there's something wrong with this person. They step back, use a gentle talk-down procedure, bring them, don't take them to jail, bring them to treatment. So here in Bexar County, there are about 1,100 people a month that are brought to 601 Frio Street by law enforcement officers for treatment, rather than going to jail and emergency rooms.
Wow, and that saves our money.
It saves the taxpayers a lot of money. Right. It doesn't criminalize you for having an illness, and it allows these people to get treatment so they can get employed and live independently and renew their relationship with family and friends.
So let's talk about families and friends. How does the mental illness affect the family, the friends, and the community as a whole?
Well, the World Health Organization and many organizations look at what they call disease burden. So what it costs society for a certain disease, whether it's diabetes or heart disease or whatever. Actually, mental illness costs society the most of any of those diseases.
Wow.
Because it causes you to be so dysfunctional you can't work, so you end up being dependent on society. it's so stressful for family and friends, and your behavior is so bizarre, and it happens over and over again, especially if you don't get to treatment, that you become estranged because it becomes so painful for family, and a lot of these people just take off and get lost. So the chronically and persistently homeless are people that have mental illness, and a lot of them start self-medicating with alcohol and drugs. And so without treatment, if you Google cost to taxpayers for the homeless, you'll get a lot of independent studies. And I think the cheapest I saw cost the taxpayers about $30,000 a year. And so we've got the Haven for Hope here in Prospects Courtyard, and we actually have a psychiatric clinic in Prospects Courtyard. And we just were awarded a grant from CMS, a healthcare innovation grant, and we're going to bring primary health care. So these folks tend to die in Texas 29 years sooner than the general population. They're uninsured, and when they do die, they're dying of congestive heart failure and a liver disease, and they end up being like $1 million patients, and guess who pays for that? Plus, they haven't been productive citizens. Right. And what we found, if we can get people into active treatment, we can get them back to work, living independently, and restoring the relationship with family and friends.
Now, there's some people that would say, why not just lock the people up?
Well, the Texas criminal justice system did that. And what they found out, and a few years ago, was these nonviolent offenders are taking up space for violent offenders. So it costs $40,000, $50,000, $60,000 a year to keep somebody in a prison. And your sentence is 4, 5, 6, 7, or 8 years. These people with mental illnesses never getting good time because they're listening to their voices, because in prison they don't get treated. So then they end up being in lockup, or if it's finally identified, they go to a medical unit that costs 4 or 5 times more than the general population. So the legislature several years ago, and this is part of the criminal justice system, not the mental health system in Texas, developed as part of the criminal justice system the Texas Commission on Offenders with Medical and Mental Impairments. They go through the prison system, they find these nonviolent mentally ill offenders, they put them on parole, and they contract with me. And Jarvis Anderson, the adult probation chief here, to treat these people. So a condition of parole is they've got to see my psychiatrist, take their medication, do their alcohol and drug screen, if so ordered, and generally stay in compliance with treatment. Well, felons on parole in the United States, 2 to 3 years after they're on parole, 40 to 60% of them have their parole revocated. In other words, they get rearrested and go back to prison. If you have a mental illness, it's even higher than that. Guess what it is if you get treated here in Bexar County? The Texas Commission on Offenders of Medical and Mental Impairments just put out a report. It's less than 6%. So treatment, it is. Treatment works. It saves the taxpayers a lot of money. It improves the public safety net, and it helps these people recover a lot in their lives.
So let's talk about who the mental ill people are in our community.
Everyone. Like I said, 25% of everybody on this earth at some time in their life is going to have a diagnosable mental illness.
So how do we prevent it?
There's lots of research going on. It's nature or nurture. Some of it, there are genetic tendencies like diabetes and other things, that, and depression and other kinds of things kind of run in families. Right. We know through post-traumatic stress that creates mental illnesses and lots of problems. So if you're a child in Child Protective Services and you've come out of an abusing family, well, you're probably broken, and so we're starting to learn a lot more about trauma-informed care and how people to overcome that. And there's, of course, the post-traumatic stress kinds of interventions that are going on. So we're learning more and more and more about how to treat these kinds of disorders and keep people healthy and functioning and happy.
It's great that you mentioned post-traumatic stress disorder, because a lot of people hear it and they think only about the military, but it's about stress that you incur, period.
That's correct. So, battered women, children in Child Protective Services, even the homeless. There's not a homeless person out there that probably hasn't been, physically abused many, many times. And if you're a female and homeless, I'll guarantee that you've probably been sexually assaulted and have a lot of other things happen to you. So, without treatment, there's just no hope. And even though Texas is 51st in per capita funding for mental health, District of Columbia puts more money in than the state of Texas. We're probably 54th in funding for substance abuse. Guam and Puerto Rico put more local dollars in than the state of Texas. Here in Bexar County, the city, the hospital district, and we, and other sources, Methodist Healthcare Ministries, we're blending, braiding, and integrating, all of these dollars, driving out the waste and duplication, and making a huge difference with not very much money. In fact, we have people visiting weekly from all over the United States. We have several countries visit. I think I told you a couple years ago I met with Eric Holder in his office in D.C. We just had the Regional Director of Health and Human Services down here, and Dr. Leckie, who's over the State Health Department, the Department of State Health Services, come and visit. So there's lots of innovation going on here in Bexar County that people don't know about that I'm very proud of.
So in the last minute, talk to us about a success story that you're aware of, someone who was taken out of a bad situation and is now a productive citizen.
I can tell you.
Pick one.
Let me give you a little scenario here. We have a sobering unit. So downtown you have bike police, and you have public intoxicants. We all see them, all the time. Those people tend to get arrested sometimes 2 or 3 times a day, and what happens is because this is America, you go before a magistrate and before a judge. Then you go to the drunk tank. They let you out of the drunk tank before you sober up because they don't want you going to DTs and dying. So people go back on the street. They start panhandling again and get drunk. So and you're never not impaired, so you can't make a good decision about becoming sober. So what we have is we have a sobering unit. Now law enforcement officers bring folks to us. We put them in this sobering unit, and about 20% a month decide to go to the detox unit in the same facility. Then detox is just intervention. It really doesn't work that well. Just ask Lindsay Lohan. What we have is, what's important is how you maintain your sobriety after your detox. And so we have 2 units on the Haven for Hope called in-house recovery. We probably have better outcomes in helping people maintain their sobriety than Betty Ford. And those people are working and living independently, most of them. We have a very high percentage of it.
Thank you for everything.
You're welcome. Thank you.
Don't touch that dial. There's more to come.